And also the insulin injections, parents really shouldn't be so scared because the needles are very tiny. It is like a scratch. It's not a deep injection.
Yes, because it's subcutaneous. It's not like intramuscular.
Right, exactly.
Hello again, we're back. So we're going to be talking about diagnosis and treatment of diabetes, type 1 diabetes. So, Doctor.
So diagnosis can be from the urine or blood tests. So the urine just checks if there's sugar in the urine, glucose as glucose. Blood tests, they will ask you to do a fasting blood sugar, which is your child will not feed overnight and in the morning have a blood test. They will check the range of glucose. If it is above a certain level, then you can get the diagnosis of diabetes from that. What else would you use?
Now, if your child comes in very sick, where your child cannot even move or is just acting out of it or is just extremely ill, depending on your blood test results and everything, some children end up going to the hospital to be managed. Some children who are not that bad, they actually just go see the endocrinologist, who's a diabetic expert, and then they go home.
True.
So depending on how bad the blood work results are, some children have to be in the ICU, especially if they have difficulty breathing, because there's a respiration that goes with diabetes when you have what is called ketoacidosis, and that's a higher level from what we're talking about here. But if your child is extremely sick, your child may need to be in the hospital for a couple of days or a few, depending on how bad, a week or two.
Exactly.
But because it's a treatable problem, most times, once your child gets the correct management and care, your child will be fine.
True.
Yeah. True. So anything else?
For diabetes?
Yeah.
No.
Okay.
Nothing.
So for doctors, we just wanted to also put there, if you're a physician watching this, please always have your patient, if you've diagnosed them with new onset diabetes, have them see an endocrinologist, preferably get them managed in the teaching hospitals, the university hospitals, because there are always diabetic specialists there. You don't want to do IV insulin just because of the risk for complications, which include cerebral edema and the symptoms that go with that. So please send your children, your patients, if you're a physician, to the diabetic specialist so that they can also get nutrition counseling.
Yes.
So it's very important what
Lifestyle counseling. Absolutely.
Lifestyle counseling. You can't drink Sprite and ginger ale and soda or Fanta and Coke like your child used to.
Exactly.
And most times there are calorie counting measures that the
dietitians would advise parents.
And then a lot of children now, when they are getting insulin, because insulin is a hormone that's actually has to be injected into the body.
Exactly.
It's not an oral pill. Yes. So if your child has to be injected, over time your child will learn how to give the insulin to themselves, but parents will need to learn how to do it.
How to do it first.
And how to count how many units of insulin is needed, depending on the blood sugar. Also, you might need to be doing blood tests
regularly at home.
At home. But there's all these new technology like the DevCom.
Exactly.
It's kind of like a little hook. It's like a small gadget, like a small, looks like a key for a car.
Yes.
And you put it on the back here or on the stomach.
They
have all these
continuous monitoring and
and if you want to check your blood sugar, you just scan it and it shows on a phone.
Exactly.
A lot of older people had it. I used to do it for a family member who had it. And you have the all kinds of gadgets, and you don't have to be doing all those finger sticks anymore.
But I think in our environment we probably still have to do those.
To do that, yes, in our environment.
And also the insulin injections, parents really shouldn't be so scared because the needles are very tiny. It is like a scratch. It's not a deep injection.
Because it's subcutaneous. It's not like intramuscular.
Right, exactly. Yeah. And after a while, it's amazing. I've seen 6-year-olds learn how to inject themselves with insulin, and it's a way of life, and they just carry on and they're fine.
When I was in California, this was like, during my residency, we went for a diabetic camp.
Right.
And we had all these little children. They would be like, oh, I feel low. And low means that they felt like their blood sugar was low.
Absolutely.
And they needed to get their blood sugar checked. And then they would get a drink if it was low.
It's amazing.
So all these children were there. But before we started the camp, they had us inject ourselves with saline.
Okay.
Just to see
how it felt.
And guess what? No pain. Those insulin needles do not.
They're so tiny.
They're so tiny.
Exactly.
They're like, what, 26 gauge?
Exactly.
The higher the gauge, the smaller the needle.
The smaller the needle, yes.
You just inject yourself.
Absolutely.
You don't feel a thing. So I was
Absolutely.
like, okay, so it's not as bad as it looks. Yes, but if your child has diabetes, get the appropriate care, get all the help that your child needs,
Yes.
and you get the education so that you're not, so that there's no problems and
And
there's
be
no
managed by the
complications.
right doctor, which is the endocrinologist.
And in the past, people would say, "Oh, when you have diabetes, does that not affect your eyes and your vision and your urine and I mean your kidneys and everything?"
Yeah.
If it's poorly managed, or
Absolutely. If it's
be-
properly managed,
yes,
you don't
can-
get those complications.
yes, and the life span and everything usually is fine once
Fine.
you're in
Properly
the right
managed.
care and management. All right.
Okay.
Anything else?
I think we're good with
I
it.
think we covered, All right, mom and dad. So thank you for subscribing to our channel and just click the button at the bottom of your screen if you are not already subscribed. Have a good day.
Thank you.
Thank you.
Thank you.